Torticollis can feel oftentimes like a stressful and difficult diagnosis for parents to really figure out how to find the best support for their child. And so, in this video, we're going to cover four main things you need to know about torticollis and how to properly support your child through this to overcome torticollis. So, oftentimes we see torticollis present in a pediatric chiropractic office, and this is something that oftentimes, as we continue to work on and improve the symptoms of torticollis, we see huge improvements in other areas, like if baby doesn't like tummy time, or if baby's starting to get a lot of ear infections. As we decrease tension and increase that range of motion, we see improvements in lots of other areas. And milestones, especially as they overcome feeling kind of like stiff and uncomfortable. And so, really, how this one symptom that presents as torticollis impacts so many different areas of baby's life. And that's important because oftentimes there's a narrative that they'll grow out of it. And we talk a lot about, as pediatric chiropractors, that you don't really ever grow out of things, you just grow into new things if the problem is not addressed. So, having a lot of tension and lack of range of motion in their neck can then yield to difficulty in tummy time. Difficulty in tummy time can all yield to difficulty rolling over. A lot of tension in their neck is oftentimes associated with either a bad latch or ear infections. And so oftentimes these things are so interrelated. And that's when we say you're really looking at the body as a whole and you're seeing how they all are connected. And so oftentimes this grow out of it narrative, it's not addressing any of the root causes. So how does torticollis happen and what's really the root cause? I think it's important. Let's start with kind of what is torticollis, just in case you're not super familiar with the term. And the term torticollis really essentially is a stiff neck. So, torticollis is when baby's head ends up like this. And when that happens, that's oftentimes from either baby's positioning in utero, because if you think baby was in the same position for 9 months, a breech positioning or low amniotic fluid, baby's positioning can yield to a lot of the patterns we see, especially in a newborn. We're looking at the position they were in utero, yields a lot of those patterns. Specifically with a breech positioning, we see a lot of tension in hips. Breech babies are oftentimes screened for hip dysplasia because of that. And so it's one of those things where baby's positioning in utero is an important thing and yields different patterns based on that positioning. And then the second most common thing or most important aspect is that birth is traumatic. And birth is the most stressful event in baby's life thus far. And so birth is traumatic on baby. Birth is a natural process, but obviously is a very physical process. Specifically, when there are a lot of interventions as well. And so, obviously, our main goal is always a happy, healthy baby. And medical interventions exist for a reason. But we can see when there are more interventions, there can be more tension in baby's body, specifically in their head and their neck, because that's how they that's how they exit the body. And so whether that be C-section or the birth canal, but that's how they exit. And so there's a lot of tension pooling on that head and the neck. And so specifically, when you hold a newborn and things like that, it's common to understand, oh, hold the head and the neck. They have low muscle tone, they're fragile, but yet during the birthing process, they're pulled out by their head and their neck. And so if there's forceps or a vacuum or a C-section, there's just more force or more pressure that can yield to more tension in baby's body, which would be why we would assess for those areas to decrease that tension. So, as a pediatric chiropractor, we're looking for things called subluxations. And subluxations are misalignment or abnormal positioning of the spine, and specifically in that upper cervical spine, where there really is the most amount of force used. Now, the other thing is we're looking for fixation or a lack of range of motion in certain segments. And that would be especially in the muscles, in the neck, and then in that upper cervical spine, and then really kind of through the trap kind of area right in through here. Specifically, there's something called your SCM. Um, but right in through here, we're looking for tension in here, fixation, or reduced range of motion. Reduced range of motion means inability to turn their head to the opposite side or favoring that one side. So sometimes it can be more severe where they really can't turn at all. Oftentimes they favor and they really fixate on that side, but that's that lack of range of motion. So we have misalignment, we have fixation, lack of range of motion, and then we also have neurological imbalance or interference. And that's really seen as a global aspect of tension throughout the entire body because that nervous system is so stuck on that gas pedal because they are experiencing so much tension, and so that's tension throughout the whole body. Their body is really tight, and so as we decrease tension locally, we also decrease tension globally. So simply put, torticollis is related to these misalignments, fixations, and subluxation patterns in children. And so, oftentimes, mild to even moderate cases of torticollis can be missed or overlooked by a pediatrician, like I mentioned, or seen as something to, quote, grow out of. Um, and that's something where, especially as a pediatric chiropractor, we look and we say, there should be optimal movement. So, we should look for and strive for optimal movement and support baby for optimal health versus just saying, oh, it's not severe enough to be worried about. And so that's why you would be able to work with a pediatric chiropractor, pediatric physical therapist, and say, hey, you know what? I've noticed these patterns and I want to address these ahead of time versus having to play catch up. I want to say, I notice these now and I know that they grow into new problems. And so I want to give my baby the support they need now to really prevent and not have to go through those things just later on. And so a pediatric physical therapist is great at acknowledging movement patterns and how to properly support baby for optimal health. And then chiropractic saying where there are restrictions or misalignments or lack of range of motion and regulating their nervous system works really hand in hand for best results. So oftentimes traditional therapy, we see oftentimes we see, okay, we have physical therapy or we have occupational therapy or um chiropractic, and really they all work so hand in hand. And so going to one of the points we are talking about how they grow into other problems, torticollis is associated with what's called plagiocephaly, which is baby's head shape. So when they're stuck like this and there's tension or they're favoring, oftentimes they're not going to like tummy time, and so they're going to want to prefer their back, and then they're stuck on one side. That's when we see flattening on one side of the head. And as we work on reducing the torticollis, increasing that range of motion, we can take pressure off the head because now they're turning to both sides. And so there's not so much constant pressure. Now they're preferring tummy time. There's not so much constant pressure. And then growing into sitting. And so we're taking pressure off that side of the head. In addition to doing some cranial adjustments just to make sure everything's in proper alignment and growing and fusing properly. So that's some of the things we look for as pediatric chiropractors that I can turn into head shape, and just how chiropractic supports and really complements other therapies. Now, really ultimately, it's important to work with a pediatric chiropractor who has experience and is specialized in this area, just to really focus on what baby needs most, and specifically really looking at that nervous system. And so one of the things that we do at Sun Life is we do insight scans or neurological scans, and that shows us how much tension is really in baby's body, and then specifically where that tension is. So we're really addressing baby's primary areas, like where they need to be addressed the most. And then we're also just supporting their entire growth and development. Having a regulated nervous system is the foundation for growth and development. And so really another thing too is that pediatric chiropractors have a variety of techniques. And so we don't just address every baby or every person the same because we understand, especially at different phases of development and different ages, there's different forces that are appropriate and there are different techniques that are appropriate. And so being able to really tailor care to your child's needs, and then specifically to really optimize results. Now, if you've seen this, if you've seen your baby who you've noticed baby is preferring one side, you've noticed baby does not like to turn to the other side, or you've even noticed some flattening on your baby's head, consulting a pediatric chiropractor, especially a neurologically based one, like our office, Sun Life, but anyone locally to you would be the best option for you to really set your child up for success. I hope you learned some things on here, and I hope that you reach out to your pediatric chiropractor near you.